Hello everyone, welcome back to our video on step-by-step tutorial to successful bonding of attachments for clear aligners. We will cover all the tips and tricks that you need to keep in mind to have perfect bonding of attachments. I hope you guys agree that good oral prophylaxis is the prerequisite for any bonding procedure in dentistry. If the patient has any form of gingivitis, it is recommended to wait for a few days to allow adequate healing of the gingiva after the scaling procedure. So once we have a patient with healthy gingiva free of plaque and biofilm, we are ready to commence our bonding procedure of attachments for clear aligners. Using a good cheek retractor is extremely important before you start the bonding process. You can either use a cheek retractor like how you see in the video, which has a buccal flange that keeps the buccal cheek away from the teeth, or you can even use Optragate. So the first step is etching of the enamel using 37% orthophosphoric acid. The simplest way to go about this step is to either keep the template or the 3D printed model in front of you and start applying the etchant on the specific part of the teeth that is going to receive the attachment. Once you have finished applying the etchant and it has remained in contact for about 30 to 60 seconds, you can then rinse it with a 3-way syringe. To save some chairside time, you can start loading the composite in the template that is going to be used to bond the attachments. Normally, other than flowable, you can use any type of composites. What we are using right now are packable composites available in the form of compules, which are to be used with a dedicated gun. After trying everything, I have found this as the best way to load composite onto the template, but if for any chance it is not available in your practice, you can use the normal composite instruments with packable composites. Take sufficient quantity and adapt well into the space of the attachment. Other than that, you can even use injectable composites available these days, as it has a decent filler content as compared to flowable, but the consistency is quite close to a flow. Using the compule, you load the composite directly into the space for the attachment with little pressure, which helps prevent voids, and then a condenser type of instrument to pack the material well into the space, making sure there is no void. One clinical tip here is you always try and keep a little material in excess, which I understand you might have to trim and finish later on, but that is going to make sure that you never end up with an unbonded attachment, which after curing stays back into the template, eventually leading to waste of time and material. You then repeat the same step for all the attachments that have to be added, and then cover the template with a light protective lid till the time you get the teeth ready for bonding by applying the dental adhesive. After rinsing all the etchant and air drying all the excess water from around the teeth, not only buccal but also the occlusal and the palatal, because eventually the template is going to seat onto the teeth, and if you have moisture on the occlusal or the palatal surface, it can get pulled away towards the buccal via capillary action and eventually compromising the bond of composite to the teeth. At this stage, based on your comfort and experience, you can decide to bond all the attachments together in one go or split it into two parts by cutting the template from the center and focusing on one quadrant at a time. If you're doing it really for the first time, you can even cut it into three parts, one anterior segment and two posterior segments, and finish the bonding process in three parts. In this case, we would be finishing the entire bonding in one go, but if you ever wish to see how you can split the tray and do it in 2 or 3 parts, write to us in the comments below and we will surely try and create a video for that. After applying the bond, you can either decide to cure it right now or place the template and cure the composite and the bond together. I prefer to cure the bond beforehand and then place the template, and then going ahead and curing the composite for the attachment separately, but this is entirely your choice. Once you have placed the template completely, you take a chewy and ask the patient to bite firmly on the side that you're going to be bonding first. Biting on the chewy makes sure that the template is seated completely and it stays there firmly till the time you have cured the composite. I also prefer to gently dab onto the tray before I start curing, only to make sure that the template is intimately adapted to the tooth and with the gentle pressure maintained. My staff can go ahead and then cure the attachment, and the same process is then repeated for each and every attachment as we move from posterior to anterior. The chewy also moves simultaneously and the process is repeated with tack curing being done for about 10 seconds per attachment. Once all the attachments are tack cured through the template, you can safely remove the template and fully cure each and every attachment for about 10 to 40 seconds based on the composite used, the intensity of the light being used, and the distance of the light from the composite. Once done, we repeat the exact same steps for the lower arch, which you can see in the video. Bonding of the attachments in the lower arch is slightly more challenging than the upper because of the presence of tongue and pooling of saliva, making it little difficult to maintain isolation. So if it's your first time, it would be extremely beneficial to cut the template into 2 or 3 parts and then apply the bond only on the part that you're going to give the attachments at that time and then move to the next quadrant or sextant. Using cotton rolls and high wax suction are extremely beneficial in effective moisture control, especially in the lower arch. So before we move on to removing excess composite around the attachments which normally interfere with the aligner therapy, affecting the fit of the aligners onto the teeth, enjoy the rest of the bonding process. Alright, once we are done with final curing of all the attachments, you can use a disc shaped silicone to remove the gross excess around the attachment. What you are seeing on the screen is a silicone with the name Enhance by Dentsply. The beauty of this disc is when it's cutting composite, you see a lot of powder coming out, giving you a fair idea as to how much excess you are yet to remove, but because of its inability to cut enamel, you are confident that you are not going to damage it. Once you have managed to remove all the excess around the attachments, you can use any spiral disc which are generally available in 2 grades, fine and superfine. Use it in that order over the composite attachments and around it to give a decent luster and polish to the attachments, which prevents it from staining yellow in our day-to-day routine, which also makes the attachment quite inconspicuous, making it truly invisible as they match quite well to the tooth shade and do not turn yellow with time. I hope using this simple to follow protocol, you will be able to master the art of adding attachments perfectly, eventually facilitating in achieving excellent results with your aligners. If you found this video helpful, feel free to hit the like button. It would really mean a lot to us. Share it with someone whom you feel it might be of some help, and do not forget to subscribe to our channel for more such videos on everything dentistry. Signing off, Dr. Mayank Doshi. See you in the next one. Cheers.